All right, everybody, welcome back to another episode of Honestly Bilal. I'm your host, Bilal Ahmed, and I'm a fourth-year medical student at the University of Toledo, and this is Honestly Bilal, the show for the aspiring ophthalmologist, where I sit down and talk with medical students who are interested in ophthalmology, with residents who are training in ophthalmology, and with current ophthalmologists in the field today. My guest today is Dr. John Miller. Dr. Miller is an assistant professor of ophthalmology at Harvard Medical School. He's also the director of retinal imaging and the associate director of the Vitreoretinal Surgery Fellowship at the Massachusetts Eye and Ear Infirmary. So, Dr. Miller, welcome.
Thanks for having me.
So, Dr. Miller, let's get started here with something that's very particular for you in general, and something I think a lot of medical students are, kind of wondering right now. It's interview season, and we look forward to kind of, trying to see our trajectory in our careers and where we're going to end up, and what we want to get out of a program or what we want to see ourselves doing 10 years from now, 30 years from now, hopefully. So you have a particular niche in a lot of different things, but one of those is retinal imaging. So talk about how you developed that niche in retinal imaging, and what do you really encourage medical students or other trainees to do to kind of develop something that they feel particularly skilled at within the breadth of the field that is ophthalmology?
Yeah, I mean, I think this is certainly a common question, and part of the decision process as to what field you might go into as you're selecting even a residency to apply for. And I think that the most important thing is just finding a specialty that can give you multiple areas of interest, and then kind of understanding that as you go through training, you're really going to develop particular preferences or practice patterns. You may work at a place that is particularly strong in one area where you can really grow that research interest and develop a niche. I think it's commonly asked if you have a 5-year plan, 10-year plan, and I think, being honest, that it's most people don't. And I think you have to have some general sense of the type of practice you want to have or what you might want to work on. There's probably 5% of the applicants who know they want to specialize in retinitis pigmentosa, and they've wanted to do that since they were 5 years old. And I respect those people, but I don't think that's really the majority of the applicants. And I don't view that as a negative as an evaluator. I think the ability to think through and diversify your interests and understand that you will get different experiences through your training is really what's going to help develop your niche. So I definitely don't expect medical students applying to have a specific plan. I think that if you do have a plan, it's important to have the appropriate parameters. So understand a little bit about how you might need to apply for funding, or sort of what type of academic environment you might need to be in to work on that type of niche if you already have one established. So make sure you kind of have some of the follow through if you do already have a particular area of interest.
Yeah, that makes sense. So what about for you? I mean, at what point did you kind of realize, was it before residency? Was it kind of during residency? When did you kind of say, I think I like vitreoretinal surgery? And when did you kind of figure out that was something that you would want to pursue?
Yeah, I think I tried to make the best of each decision at each stage. I went to a very tech school for undergrad. I went to MIT, and I thought a lot about engineering, and ultimately ended up in biology as sort of engineering of the body and medicine ultimately instead of the PhD. So at med school, I'm a sports nut and love basketball and rowing and all that type of stuff. So I was always pretty interested in orthopedics versus sort of the other surgical subspecialties. And I was really drawn to ophthalmology because of the precision and the ability to both treat and diagnose your patients both in the clinic and in the OR, and really be a comprehensive physician for a particular area. Many of the other surgical specialties often have to kind of work with the medical counterpart. And there really isn't that in ophthalmology. You can really take care of both medical patients and surgical patients all within a subspecialty like retina. Retina, I found the most interesting because it has a lot of innovation and it has imaging advancements all throughout my training. And the surgery is particularly beautiful. I mean, I could look at retinas, even as a med student, I found it just the best examination that I had in all of medical school was seeing the fundus, and really all the different systemic manifestations you can identify with the fundus exam was always very cool to me. Yeah.
No, I think that's one thing that I think a lot of medical students are maybe cautious of. They think that, oh, well, maybe this is too premature for me to think about long term, or maybe I don't know if I like it enough. But I think that's one of the things that's really great about ophthalmology in general. And part of the reasons for this show is to expose medical students who may not get a lot of exposure to ophthalmology, is that you touched on a lot of the things that are unique to ophthalmology that you get to do in medicine, you get to do surgery, and you also do a lot of imaging as well, especially something like retina. So it kind of is a mix of all the best fields of medicine in that kind of regard as well. So I think that's nice that you kind of
Right.
detailed how you kind of went through the process as well.
I think as far as picking imaging as a niche, it kind of something that I somewhat stumbled onto. I mean, I've always been interested in technology and innovation, and I find interpreting OCT or optical coherence tomography, what we use for macular degeneration diabetes, I find that always found that pretty interesting and really specific. And I started working on some small imaging projects, and then I happened to be a fellow at the time that we were getting a new swept source OCT device that was not FDA approved. So I helped write the initial protocol for that as a resident prior to fellowship and helped bring it for both the glaucoma and the retina department. And then that was really my research focus as a retina fellow, putting out papers both on that investigational device as well as other OCT projects like traumatic macular holes or things that had some tie-in to sort of surgical retina. And that blossomed into more of a niche over the first 5 years now of faculty life.
That's awesome.
But it wasn't something I set out into as a resident.
Right. I mean, it's one of those things, I guess you kind of developed it. It was opportunity, and the opportunity became something that's now what you do today. So, when it comes to innovation in retina and talking about surgical innovation or imaging innovation, one of those things is surgery. That's a big topic in ophthalmology, specifically in retina as well, with technology such as Ingenuity. And I know that you've done work with John Kitchens as well, somebody we both know, a former guest of the show and a mentor of mine. Talk about 3D surgery. Talk about the idea of how that's going to change education, whether it's training, whether it's, and what the benefits of 3D surgery are going forward in the field.
Yeah, I think that 3D surgery or just the concept of an enhanced surgical image is really important. It's potentially going to change education as well as the field of surgical retina. The microscope is an amazing advancement, and operating microscope has been around a long time, and there are continue to be improvements in the optics of those microscopes, but there really are some limitations in the ability to adjust the image after the fact and also show that image to multiple people in the room. So the advantage of Ingenuity or Zeiss has a similar 3D heads-up display that everyone in the room, the medical student or the scrub tech or the circulating nurse or even the anesthesiologist will sometimes walk around and throw on the glasses and watch the surgery. Everybody can really be engaged and know what's happening and see what you're doing. So in the room, I found that to be particularly helpful for med student education. And one of my former med students, Talia, actually, we wrote a nice paper that was published in JVRD over the past year, analyzing this user experience with Ingenuity. And we showed that as compared to the standard sort of overhead 2D monitors that the med students are usually forced to watch on, or even the side scope, the 3D technology was tremendously more popular for all the different types of surgery and also for understanding the anatomy of the eye better. And I think really engaging the medical students, I think that is actually maybe the biggest impact is on the med students.
Yeah, I agree. I mean, as somebody
Go ahead.
No, I was just gonna say, as somebody who was in the OR, I felt like that it was really what made the difference for me in retina was watching that kind of surgical experience with Ingenuity and seeing that whole different dimension of what it means to be in an OR and really get to see what's going on, especially when it's coming to microsurgery and have such a big display that shows you what's really occurring in real time. That was kind of something that really influenced me and something a great experience.
I think it can be disruptive too to trainees. Say you're learning surgery and you've done many cases on the operating microscope and now you're trying to shift to a newer technology. So, but I think having that versatility to be able to operate on different fields of view and different imaging tools is going to be the future, and it kind of broadens your depth as a surgical trainee. So the fellows as they adapt to it really do pick it up pretty quickly. I think the younger generation has a great learning curve for these types of technologies, but I do think there has been some resistance from the field in general. But as we sort of demonstrate some more value add sort of to the patient care aspect with different filters or tracking technology that helps sort of guide surgical steps and surgical maneuvers to optimize them, that's really where this technology is going to go even further. And you mentioned John Kitchens, and something that we've been working on is some telementoring and telesurgery. So we had a project with Verizon over their 5G network last year that basically demonstrated we could stream the 3D 4K with very limited latency across the river to their Cambridge office from Mass Eye near Longwood. and I could have another trainee there with a mentor doing some teaching directly on the screen in real time, and then also communicating back to me in the OR. And for that, we used a very high-tech, high-grade security platform, but there are some plug-and-play, sort of off-the-shelf, $100 type solutions that John Kitchen, Steve Houston, and I have been working through, and you should be seeing some publications on that soon.
I think that's the best part of that, this telecommunication sort of technology for training purposes. I think that can have so many applications, not only from a national prospect, but also from international as well. We talk about global health and stuff. I think that's a really exciting opportunity. So I think that's excited to see how
And
that.
even with the pandemic, we've had some restrictions on the medical students being able to come to the OR or come to the hospital. So I think we've also been able to demonstrate that you can stream that same live surgery to another location where the students could safely watch if they are restricted from attending certain cases. And with the 3D, even better, because you can watch in 3D and really see the anatomy better than you would with just your typical live surgery that you're most frequently seeing at a lot of these retina meetings.
That's awesome. I think a lot of medical students who I think it's my personal belief of my own experience, and I think there's a lot of other medical students. If you're a little bit interested in ophthalmology, I think seeing one retina case with Ingenuity probably gets you a little more interested.
More excited, yeah, definitely.
Thanks.
I've seen that too.
Yeah. So, talking about that, talking about the next generation, you mentioned, the pandemic and how that's changed a lot of things. So, another one of your interests is in health delivery models and how we can change hybrid models for delivering better care, value-based care. And that's kind of the system going forward in medicine. And that's kind of the movement of where things are going to be going with value-based care and with how to deliver things in a different way. And especially after this pandemic, there'll be probably new ways to deliver that care consistently. So tell us about what do you think are some key details for medical students, residents, fellows, people who are just in training going forward from this pandemic in a post-pandemic world. Some ideas to keep in mind about how healthcare delivery will change and what they should try to do during training.
Yeah, I think that the pandemic has really accelerated some of the efforts that have been going on for decades. Telemedicine and the concept has been pushed, certainly on the international level, and we've seen some here within the US, but it's not the traction has not been great within ophthalmology in general. But the pandemic and some of the stay-at-home restrictions or limited, social distancing, limited patients in the clinic has forced us to look at alternative ways to deliver care. So sort of from March and April, we've really been pushing a hybrid approach where the patient can still come in and get their digital imaging at any of our locations. And we're hoping to increase those testing locations beyond the typical eye clinics. But with that digital imaging, specifically OCT and a wide field fundus photograph, you can really review and diagnose and kind of carefully interpret many different things for the patient without them having to come, sit in your waiting room, wait to be dilated, wait for the doctor, wait for the interpretation, and then go home. And you can spread out. We can also offer more visit time. So I have virtual visits sort of throughout the week, and that's allowed folks to come on a schedule that works for them as opposed to the schedule that works for me. So I found that there's been pretty good response to this. I mean, certainly the case numbers had sort of gone down over the summer. It's starting to pick back up a little bit here in the Northeast. So I don't know. I think we may see even more interest in these types of concepts, but there are certain things that I just don't know will go back. I mean, the best example I could think of would be plaquenil screening. And almost everything that we do when evaluating plaquenil toxicity is really from the digital imaging. There are not that many specific exam findings that the patient really has to be examined in the clinic. So with a good OCT, a visual field, and autofluorescence, I can really give a very good assessment for the patient as to their relative risk or possibility of toxicity. So that's one example, but there's dry macular degeneration, diabetic retinopathy screening. Most of these things can be done with good imaging. So I do think that there is a future, and med students should be aware that there will be these sort of hybrid delivery methods of care. So I think it's exciting, actually.
Yeah. I think it's also nice to see if there's, the institutions that are out there that will kind of promote those kind of training models to kind of get, trainees used to that. That would be nice to see that kind of becoming a forefront of medical training in some way or another. And it's exciting to see what you're doing for innovation, what you're doing for education. And it's always a pleasure to meet a new guest, especially somebody who, knows mutual people in the field. So I really appreciate you taking the time to talk with me and really give us some guidance about what are some particular, ways to really develop a niche, whether it comes to how to get involved with research and make it a lifelong sort of focus of a career, and then also what to look forward for in trainees as our generation comes across a post-pandemic world.
I think just, last parting words sort of the trainees is just stay passionate and stay excited. There's lots of different career paths, and don't get disappointed if you run into roadblocks with something that you're hoping to be your niche. I mean, I think if you look at the most successful people in all the fields, they've transitioned at different times based on what the time required. So I think just, keeping your head down, work hard, study, and do your best, and you'll all be very successful.
All right. Well, Dr. Miller, I hope we cross paths in the real world someday. We've met in the virtual world now, so I look forward to meeting you in person, and you take care.
Thanks a lot, Bilal.
All right.